Welcome to the Perfect Place to Put a Practice podcast by Scott McDonald and DrDemographics.com, the best source of demographic, psychographic, and marketing information for professionals.
Hello, everybody. This is Scott McDonald of Dr. Demographics, and today we're going to be on a particularly important topic because in the time that you're trying to figure out where to put a practice, and that is, after all, what we do, you're going to find out that there are some facts that people want to share with you and say, oh, that's a good place or a bad place. And the calculations are not based on, well, reality. Now, I'm not going to say they're intentionally being false or they're trying to lie to you. But a lot of our competitors don't understand competition. Now, they may understand demographics. They know how many people there are in a given geographic area. They know where competitors are going to be found. The problem is they very often don't know what it takes to determine whether there's room for one more and what the desirability of the site might be based upon competition. Now, the competition ratios are particularly important. They were something that when I first started the business, as I'll mention in a moment, I used to have a lot of questions from the doctors I was working with. They'd say, how many doctors are there in my field in a particular geographic area? As though there was some answer that they were told in professional school that would tell you exactly whether there were too many or too few. That's a problem because there are all kinds of rumors and statistics that are available that are not really important for you to know regarding competition. And I believe a lot of times you're making assumptions about people who are practicing that are not really true. So let me get into this today. Today, I want to talk about competition and how they're being a little deceptive with the numbers, but sometimes out of ignorance. Now, I'm saying that there are some big lies about the competition ratios. And I think that the lies are primarily coming from ignorance of statistics and also the nature of professional practice demographics. I don't want you to make this mistake. Here's why I think that. There's some big lies and errors, and I would say they're more often errors than anything else, about competition ratios, and you have to know the truth before you get stung. So if you're going to buy a practice or you're going to do a startup, you have to know what's the lay of the land, what's the competition really like. I want to talk to you a little about that today. I want to talk to you about where the statistics come from and what you can do about it. Unfortunately, most doctors are unaware of the damage this can do to their practice purchase or the transition if you don't know the competition facts. Now, typically this is referred to as the competition ratio. How many doctors are there relative to the patient base that you're hoping to serve? At one time, as I mentioned, the first thing that doctors wanted to know was kind of a fixation upon what's the competition look like. The problem with that is even when I could tell them the exact answer, they would sort of assume that's too many or that's too few and not have any basis for that assumption because they don't tell you this in professional school. In fact, when I've spoken at medical and dental schools throughout the United States, usually in the practice management segment of a course, sometimes they'll have a class on marketing. The people who are talking about it are usually clinicians. They don't know as much as they think they do about the statistics. At Dr. Demographics, I've spent a lot of time and effort in trying to help doctors figure out, is there too many or are there too few? And how far are they or should they be from the practice? Obviously, different practices are going to draw from different practice areas. And I usually express that in terms of drive time. But the problem is there is no generic term for a drive time for an endocrinologist or an endodontist or an orthodontist. How far are you able to draw? Now, that is an entirely different discussion that I would like to have again, because it's being updated all the time. But the competition ratio is not a simple matter. And it's extremely unhelpful if you simply say, in a generic sense, how many other professionals are there within that radius? And part of the problem is you don't know how to define who is in your competition. I don't think, like I said, most of my competitors are evil, but they're often wrong, and I want to explain why. Now, I'm calling these lies and errors just because I think they're making some miscalculations, and that's unfortunate. All right, let's go on. Doctors have assumed that there is an ideal ratio to say, yes, a practice can survive here because the ratio is a certain size. A number of competitors within a local area are going to be sufficient or too many for you to survive. The problem is really the population. The patient base is always going to be different. And if there are people who are rich and highly desirable, well, the practice can withstand a much higher competition ratio, more providers per population. When it is low, it can't. But even the distance that people are willing to travel will depend upon the type of practice you're referring to and the kinds of services that you offer. So if you are an endodontist or a dermatologist or whatever, the kinds of services you offer are not identical. And people will travel further to get some services than they will for others, even if the doctor type is the same. So are all dermatologists in competition with all other dermatologists? And the answer is no. There are those who offer a specific service that people might be willing to travel further to get. And you have to know that the clinical differences between offices will matter. As an example, veterinary medicine is greatly different for the types of animals, pet companions that you have. People are willing to travel further for some types of animals and some kinds of conditions than they are for others. I'm not going to get into it at this time, but I'm going to say at Dr. Demographics, we have made a study of all the different kinds of practices that there are and how far people are willing to travel for certain animals or certain patient types and how much that travel is going to be worth to them. Now, there is no ideal competition ratio. And you have to consider that the ratio is a matter of time and distance, not just the number of competitors there are within a particular zip code or area. The fewer the competitors, the better. And that's been what the generic has been. We always assume that with fewer competitors, you're going to have an easier time. But that presumes a couple of things that just aren't true. And that is, all patients and patient types are not the same. They are different in their demographics. Some services are different and are therefore more desirable to travel to get. These things matter a lot when you're trying to figure out, is there room for one more? Now, I want to tell you how I found some of this information out. I usually haven't gone into this, but I think it might be worth talking about. In Beverly Hills, I did a real particular study. Now, for anybody who knows Beverly Hills, you can't swing a dead cat without hitting some kind of healthcare provider. There are a large number of them per population. Are there too many? I did a similar study in Scarsdale, New York, in which I took a variety of different practice types and procedures and tried to determine, is there room for one more? What was interesting about it, we'll take the Beverly Hills study in particular. Like I said, there are a lot of professionals in Beverly Hills, and one could easily reason there are too many. But the very idea that it is Beverly Hills, people are willing to travel greater distances to get care there. And you may say, oh, well, they're all rich. Not necessarily. There are a lot of people in the middle class, for instance, who know that a Beverly Hills trained cosmetic surgeon is going to be more experienced and better, perhaps, because of the types of people that they're serving or the variety of cases that there are. Even the procedures they're doing are going to be a little different based upon geography. And in Scarsdale, on the other coast, the same thing happens. Some people say, oh, well, my doctor is in Scarsdale, and people will consider that's a better place to go. Now, the competition ratios are much higher in Scarsdale and Beverly Hills. They're much lower in St. Joe, Missouri. That doesn't necessarily mean that a doctor can't make a significant living in a more rural, less dense population. It also doesn't suggest that people have to be rich in order to afford your services, and I'll talk about that in a minute. But the idea that you only want to go to a place where there are not competitors is a mistake. Very often you'll find the places that are best have other people who are working there, and the area itself gains a reputation, a positive reputation for particular services. Accessibility, how long it takes to get there, how close it is to a freeway or a turnpike, can matter a lot as well. But when we talk about competition, it's a much more complex issue than most people will believe. The problem is that patients and potential patients are not generic. There are going to be some people who are, because of their education, income, employment type, insurance, they're much more willing to pay a higher price, a premium, to get treated at that place. That just means that the patient base is different. It's not generic. So you don't just say, oh, well, there are already 20 orthodontists in this area, and therefore it's already full. That is not how it works. There's a lot more complexity, as I will explain, to choosing locations and determining how many competitors are too many. Some patients are much better for a practice than others. Now, there's a weird idea that rich people are going to be better patients than poor people or middle class. And look, the truth is sometimes rich people are real picky and a pain in the neck. They are going to demand so much that they may not be a particularly worthy population to serve. Don't get the idea, therefore, that money is the primary thing, as well as the number of people in an area per generic competitor. That is all a variable. Now, when you do a report with us, we're going to examine the size of the population and its growth, other consumer characteristics. We're also going to look at the competition and try to determine what services they're offering to see if they really are a competitor, and they may not be. It's not by looking at a bunch of numbers that you're going to make that determination. It's not just the quantity, it's the quality of the population or competition that you're really having to take into account. How much money they have is not or does not define the desirability for the practice. So let's lose the idea that you only want to put the practice in a very, very rich area, or that you want to do it where there are no competitors, because those are two demographic variables that are not really going to help you. Their housing, educational attainment, marital status, profession, occupation, number and age of their children, etc., are much more important to the success of your practice than other facts. And by the way, I'm going to say there are a lot of other factors you need to take into account. So when we are looking at the viability of a site, or trying to find a good location for you to go to, we have more work than simply to say, oh, there are other competitors it's too full, or you got an opportunity because there are not too many. The desirability of a patient base by demographics and by psychographics may matter much more than the number of competitors there are. Now, there are other things about the competition ratio you should be aware of. And one of those is, a lot of people say, well, the person is a licensed whatever, an endodontist or an orthodontist or a maxillofacial surgeon or whatever. And you may assume, well, there already are people there, but they are not all offering the same services. Just as a simple example, there are pediatric versions of these specialties that are going to matter much more. There are reasons why going to a dermatologist who handles very young children will be very different than those who are geriatric gerontologists, dermatologists. So what they offer and how they offer it will matter a lot to you. We are not looking simply at the competitors from the point of view of they're all the same because they have the same kind of title or credential. We also have to look at what they're offering within their practices. Now, it is not the number of patients per provider that really counts. Rather, it is the kind of patient per provider that counts. We have to look not just at what services that the provider has, but also what kind of demand there is based upon the demography and psychography of the population that's there. This is a very complex thing. This is really hard to understand, but it is why Dr. Demographics has done so well over the years. We're not like others. We go a step deeper. Now, really, there are 4 numbers in terms of competition that you need to keep in mind, and it's not just the number of providers. There's much more. The universe, the number of people in a practice area, is going to count. Even if you decide that you are a pediatric specialist and you're only handling children, you still need to know how many other people there are out there, and is that number growing? Is it shrinking? Or is it changing in its character? The target population is the other thing I want you to know, and that is the subset of the population you want and their growth. All right. I did a study for a practice, an orthodontic practice in Florida. At the time, it was fantastic. They were just doing fantastic. Oh, great. The number of adolescents within that neighborhood was very high relative to the number of orthodontists there were. However, you got to keep in mind that's not the only population that really mattered. You have to know if that population is changing, in other words. And if you don't know if they're changing, the value of your practice may rise or may fall precipitously. I have found that insurance type changed in one school district in Los Angeles, and it completely bankrupted the other practices that were serving a large number of those teachers. It happens, and you have to be able to identify that and anticipate it as a demographer. So the target population is particularly important. Are those people going to fit the demographic model that you want to get? Now, LASIK surgery is an example that for a long time, it was serving the ophthalmologists very well. But because the technology that went into orthognathic surgery changed, it rather hurt the practices of existing ophthalmologists in the area. That can happen. So a good demographer will keep an eye on changing technologies that will serve different segments of the population and open them or shrink them for the doctors that we're serving. It counts, in other words, that you're looking for a doctor, or a demographer who understands doctors. Now, the real competition is kind of a problem, and I'll use dermatologists as an example. There are lots of dermatologists who are treating adolescents primarily, and the services that they offer are targeted toward that. But not all dermatologists are wanting to work with adolescents, even though there is a need for that in a particular market segment. There are geriatric dermatologists as well. There are those who are cosmetic dermatologists who are trying to restore the look of the skin in certain cases. They are not serving the same people. So in other words, you wouldn't say just because a person's a dermatologist, they're automatically the competition. They may be, but then again, they may not be. How does this play into Mohs surgery? That's what I'm getting at. Now, the drive time of the second and third, the target population and the real competition, are going to be figured in drive time radius. Each practice type has a different distance that people will travel to get services. Now, you already know this, I'm sure, that specialists tend to draw from a larger geographic area than others. I got it. You know that an orthodontist in most middle-class metropolitan areas, suburban areas, let's say, people are willing to travel a certain distance, but you know, that's not true in every case. So the drive time radius, whether it might be 7 minutes or 10 minutes, will determine the viability of the practice site or the practice in that site. So you've got to figure drive time analysis, not radius. It doesn't matter if it is 10 miles away. If it takes a long time to get there and the population is urban, fairly crowded, they won't travel. We know that in an urban area, people will only go maybe 7 to 9 minutes to a dentist, general dentist. But we also know that in a suburban area, they will travel further. In a rural area, they will travel even further. How far is too far or not far enough? That's what we're trying to answer. Each type of practice is unique, and this will influence their calculations. You must have a firm calculation for each type of practice, how far people will travel, and what they will pay for a specific service. Now, this is going to throw you for a loop. Ideally, you will know the total number of provider hours per practice profile per radius. What I mean by this is there is a concern among physicians and dentists that you have to have a certain number of people per drive time radius. But the reality is you don't know unless you have an idea how many provider hours there are, how many people are working a certain number of hours doing a procedure to make it viable. Now, let me give you an example. We know a lot of general dentists who do Invisalign, an orthodontic procedure. All right, Invisalign is not the same thing as full banding that most orthodontists might do. So they're not truly competitors. There is an outcome that is the same with straight teeth, but they're different technologies and therefore different costs. There are some people who are dabblers in what they do. They don't do very many orthodontic cases, and they may be a general dentist, or they may be an Invisalign doctor, and they are not doing full bands. It will make a difference. And I'm also just using this as an example for other kinds of healthcare practices. It will matter a lot. Ultimately, you know that a person who is going to devote years of education and sacrifice in equipment to go to the expense of diagnostics, treatment procedures, machines, in other words, to make these things happen. It isn't inexpensive, and not all practices have the same equipment and don't offer the same services. Sometimes the varieties are going to make a difference of the viability of the practice. I'm not going to go into all of the different technologies that exist in healthcare. I will simply say that it makes a difference in how much you have invested in this equipment, diagnostic as well as treatment. And it makes a difference in terms of the overhead that you are incurring to say whether or not this is a good idea for your particular practice area. Dr. Demographics can help you answer those questions by telling you that there are a certain number of people of a particular type who want the treatments that you're offering. And that's what we're here to help you with. Now, give us a call at 800-849-0499 or visit us at drdemographics.com. You want to know that our prices are listed in the drop-down menus. There are basically 4 different kinds of services that we have, and each one has a different purpose. There are 2 that I want to talk about just briefly. One is the practice viability report. In other words, if you're going to invest $1 million in an area to put up a new practice, to hire staff, to go out and market, you're going to have to understand if the way that you see the vision of practice in that area is viable. That's why you need that report. On the other hand, there are other kinds of reports like a marketing report, which will get much more into what to say about your practice and what your competitors are saying about their practices. It's not the same thing. So a marketing report is more intuitive, and frankly, it's going to be a great investment to pay a little bit extra to know what the answers to these questions are. It's an expensive business that you're in. I don't want you to waste your money. Now, this is Scott McDonald. Mike Green is the one who's going to probably answer the phone. He and his staff, they are going to be brilliant at this. I know, because I've worked with them for many years. Thank you much for watching, and we hope to talk to you later. Bye-bye.